Are you unsure if you want to see a midwife or OBGYN for your prenatal care? I'm Nicole, I'm a certified nurse midwife and first-time mom. Let's break down the difference between getting your care with a certified nurse midwife or OBGYN. OBGYNs are medically trained doctors that specialize in obstetrics and gynecology and focus more on high-risk patients and to perform surgeries such as C-sections and manage complex medical conditions. Certified nurse midwives are advanced practice registered nurses or APRN. So nurses that have either their master's or doctorate in nursing practice, which is what I did to specialize in midwifery. Midwives emphasize a more holistic and personal approach, typically managing lower risk pregnancies, meaning one baby with the head down. We can prescribe medications, manage our own patients, and attend births in hospitals, birth centers, or at home. But we do not do surgery. And yes, you can still give birth in a hospital with a midwife and get an epidural. That's what I did when I gave birth. Midwifery teams have a scope of practice that outlines what patients they can care for, which ones need an OB consult, and which ones risk out and need a transfer to the OBGYN team. For example, in my practice, I can manage patients with gestational diabetes as long as it's diet controlled. If they need to go on insulin, it's a transfer to OB. We can also manage patients with mild preeclampsia, but once it becomes severe, then we transfer. If you've had one C-section and are trying for a vaginal birth, you can also see a midwife, but you usually just need an OB consult. Research shows that if you are low risk, seeing a midwife can actually lower your rates for C-section, medical interventions, inductions of labor, and episiotomies. You're also more likely to breastfeed if you see a midwife and have higher patient satisfaction. Put your pregnancy questions below.